Hi, my name is Eva Czermak. I'm a Rotary Peace Fellow from Chulalongkorn University. I live in Graz, Austria, where I'm the head of an NGO where we medically treat people without health insurance or people from marginalized groups free of charge. Today, I'm here to talk about the connection between health and peace. On the most basic level, everybody cares about their children when they're sick. And on the physical level, we all have the same blood and we feel the same pain. There is no difference between you and me when we are sick. On a different level, there is also the option to do some work across cultures in medicine, like me and my colleagues have been doing the last couple of months. My colleagues are doctors in Burundi and India who are preparing peace and medicine projects there, and they are now going to talk about their planned projects. So, Dr. Louise, why is this project especially important for Burundi?
Many people think that chronic diseases are a problem of a rich country. But actually, the chronic non-communicable diseases are also a problem of poor country like ours, Burundi. For example, there is a high number of patients suffering from disease, chronic non-communicable disease. For example, the diabetes is the first cause of hospitalization in our country of patients. And it is the reason of 40% of amputations. The cervical cancer is responsible of 44% women's death from cancer. High blood pressure is usually associated with diabetes in a 40% case. The probability of dying between age of 40 and 70, one of this disease is 24%. I hope in that context, the management of this disease generally difficult in terms of technically and financially. It means becomes very difficult, so that it is very needed to do this project in Burundi.
Thank you. And how do you see that in your project health and peace are connected?
Our project can contain the peace because health care is one of the primary way in which members of a society expresses their commitment to the well-being of another. It means that people who are suffering from those different diseases are coming from a different group, and the same of the healthcare providers. When we give support for the kind of people, they understand after the support that the problem is not the different group, but the problem is about the matter of the disease. Why I think that is we can have the link between our project of health and the peace.
Okay, thank you. Why is this project especially important in India?
It's very important in India. It's particularly very important in my state, Assam, because my Assam state have the highest maternal mortality rate right now, and it has also the highest infant mortality rate. So if we see the data, we can see that the maternal mortality rate in Assam is 300, which against the Indian figure, the national figure of 167, which is almost double. And also the infant mortality rate is 44 against the national figure of 37. So my research study suggested that the average fertility rate among the tea garden laborers, which I'm focusing on, is 5.2 against the national figure of 2.4. So there are no proper family planning services due to lack of proper awareness and illiteracy. So I think my state is the right option so that I can implement my project here.
How do you feel that your project is connecting health and peace?
Yeah, I think my project will definitely contribute to peace. Normally, in patriarchal societies like India, husbands or partners occupy a dominant or supremacy positions and are not involved in family planning and reproductive services. So if we create awareness on equal participation of wife and or husbands in family planning and child care, we can initiate a process of good health and well-being of a family. So for me, peace means good health and well-being on all the family members. So my project is definitely will help of all the family members. Thank you.
And finally, I want to present you a project that we added only recently. It is run by Dr. Rémy Zilliox of France. He's a plastic surgeon and he has been treating victims of burns in Nepal. I'm going to show you some slides about his project. Thank you very much for interest and watching. I do hope you will join us at the Rotary Peace Project Incubator and finance one or all of our projects. Bye.